Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everybody, Tom Viola from Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, we're continuing in our discussion of opioids, and I will tell you that my position on opioids sometimes gets me into, hot water with my colleagues in dental pharmacology because not everybody agrees on how opioids are best used or used at all in managing dental pain. But I'm of the opinion that opioids are valuable tools in managing odontogenic pain when the combination of ibuprofen and acetaminophen just doesn't cut it. And there are times when patients are in significant pain. And therefore, to not treat them with an opioid would be doing them harm. And we all practice under do not harm as our credo, right? So therefore, we need opioids to some degree. Now, for analgesia, we know opioids are impressive in their ability to relieve pain. But again, they're not primary agents. Why? Because again, dental pain is acute inflammatory pain, and there's nothing anti-inflammatory about opioids. So they can manage the pain and blunt the pain, if you will, but they can't really treat the pain. So they're used in concert or concomitantly with ibuprofen and acetaminophen to manage significant or severe pain. Now, if the patient doesn't have that type of pain, they don't need an opioid, right? And only you, the clinician, know that. If you've manipulated bone and tissue significantly, you know who's going to be in pain. So if those patients don't look like they're going to be good candidates for lots of pain, then they don't need an opioid. So, of course, the first step in prescribing an opioid is knowing when not to prescribe one. Okay. But there are other uses for opioids outside of dentistry, which keeps them alive and well, with things like using opioids for treating cough. Certain types of cough are just, impossible to treat with over-the-counter drugs, and therefore an opioid is necessary to suppress the cough reflex in the brain so the patient could get a good night's sleep, for example. And of course, there are cases where patients have diarrhea or hypermotility of the colon, and therefore, find it difficult to control without opioids to give them some stay, some ability to recoup their control. So in those cases, opioids are necessary. So I would say there's always going to be a place for opioids in medicine, and therefore there's always going to be a place for opioids in dentistry. The thing, my friends, the key here is to be able to know when to prescribe them and when not to prescribe them. And if you are going to prescribe them, to know how to prescribe them appropriately to avoid diversion, to get the best results for our patients with the least number of doses to prevent the potential for dependency and addiction. That is the challenge that faces all of us as dental professionals when it comes to opioids. And we always rise to the occasion, because I can tell you, after being a pharmacist for over 30 years, I don't think I've ever seen a dental practitioner prescribe more than a few dosage units of opioids. So in my opinion anyway, dentists and oral surgeons may very well be the most appropriate prescribers of opioids I've seen so far. But that's for another episode of Fast Facts Pharmacology, my friends. And for now, this is Tom Viola saying, have a good day, every day, and be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products, from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.